Community Analysis, The City of Winter Haven by Goldsmith. The purpose of this PowerPoint is to provide details regarding the City of Winter Haven. The information covered will include a historical overview with the origins of the city and its evolution over time, the structure of the community, and population information. Also discussed will be health-related resources and their access, acceptability, and affordability, as well as 3 community-specific Healthy People 2020 objectives. Environment, government and public policy, community needs, and a summary of global and community issue will also be addressed. The Polk County area was initially settled by Native American Indian tribes called Calusa, Timucua, and Tocobago. After European exploration of Florida, these tribes declined in numbers due to illness, and Seminole Indians from Georgia gradually replaced the original natives. Cattle herders are thought to have moved further inland after a hurricane in 1848. By the late 1800s, the South Florida Railroad had extended through Florida into the Tampa Bay area, and multiple towns were developed along it, including the area that would become Winter Haven. In 1861, Polk County was formed. The city was formally named in 1885 after the name Winter Haven was proposed due to the area's warm climate, and then it was incorporated in 1911. In 1915, the 20 Lakes Boat Course Club was created and started the process of adding canals to connect the lakes of Winter Haven. This is now known as the Chain of Lakes. Many crops are grown in the area, and Winter Haven became the home of the Florida Growers Association. Crops that are now grown include citrus and other fruits. Cypress Gardens was an attraction founded by Dick Pope in 1936 and displayed water ski shows in the 1940s. It has now been converted to Legoland of Florida and still has a ski show. In 1959, the American Water Ski Association founded its headquarters in the city of Winter Haven, and in 1980, the American Water Ski Educational Foundation created the Water Ski Hall of Fame Museum in Winter Haven as well. The city of Winter Haven has evolved from tribal lands into the beautiful agricultural and tourist town it is today. Structure. The city of Winter Haven offers various types of housing. RV parks, mobile homes, apartments, condominiums, and houses are available. Most neighborhoods are well kept with nice lawns and maintained homes, although occasionally an area might have clutter in the yard or have paint peeling from the home. There are several forms of transportation available. The major roads are Cypress Gardens Boulevard, Havendale Boulevard, and 6th Street. These roads are well maintained and kept in good repair. The Winter Haven Area Transit through the Citrus Connection is the bus system that runs through the city of Winter Haven. There are several taxi companies that service the Winter Haven area. They include D&D Taxi, Imperial Cab, 863 Taxi Service, and Economy Taxi. Volunteers in Winter Haven and throughout Polk County assist cancer patients to their appointments through a program set up by the American Cancer Society. Subsidies and homeless provisions. The Winter Haven Housing Authority offers low-income apartment rentals and housing vouchers, and the Salvation Army of Winter Haven offers emergency shelter to women and children. Various social services are offered throughout the city of Winter Haven by its churches. Potential structural issues in Winter Haven include the lack of transportation for those below the poverty line. The Winter Haven Area Transit does offer cheap rates for the city bus, but even these rates may be too expensive for those living below the poverty line. Also, there are shelters available for women and children, but shelter accommodations for homeless men are very limited. Another issue that could be a problem is the age of the buildings. They may have lead paint, and some of the older homes are not in good repair and may be dangerous to residents. There are several population issues that affect Winter Haven. The city of Winter Haven has a greater percentage of its families that are receiving public assistance and are below the poverty level, with less families earning middle and upper middle or above incomes than the rest of the county or state. The crime rate is also higher than the national average, especially in regard to violent crimes. There is also a seasonal fluctuation. Florida experiences higher population numbers of older adults during the winter because of snowbirds. There is also an increase in the number of people due to spring break, which is generally from February through April. This results in traffic congestion and may contribute to the spread of seasonal illnesses. Health concerns for the Winter Haven population include heart disease and cancer as the leading causes of death for Winter Haven residents. From the literature, neighborhoods with higher levels of crime increase the risk of cancer in males, and for women, poverty increases the risk of heart problems and high blood pressure. The communicable diseases chlamydia and gonorrhea are also of concern. Wickerama, Merton, and Wickerama advise the rate of sexually transmitted infections within a community is multifactored, but communities with high crime rates and high poverty levels tend to have a greater percentage of individuals with sexually transmitted infections. Health-related resources. Access to healthcare services is acceptable with most needs covered, although trauma patients would need to be transported nearby to Lakeland Regional Hospital. Many social services are available, including Meals on Wheels, activities through the Senior Adult Center, and support is available for pregnant women and special needs children. Acceptability. The care provided throughout Winter Haven is mainly through Western medicine methods. Traditional methods of healing are not available and would be difficult for residents to obtain care through any of these methods. Affordability. Healthcare is affordable for those with insurance, but self-pay office visit costs can be expensive and could deter care. There's a free clinic available to those who meet income requirements. However, anyone without insurance who does not meet the income requirements for the free clinic would have substantial out-of-pocket costs for any care. Healthy People 2020. The three chosen objectives are related to obesity, lead paint testing, and violence prevention. Many of Winter Haven's residents are obese or overweight, and this can lead to future health problems. Early education can help to reduce this problem. In 2012, the Winter Haven area ranked number 7 for most obese cities through a Gallup poll of 190 metropolitan areas. Lead paint was used in homes built prior to 1978, and many Winter Haven homes were built before then and need to be tested for lead for the safety of the community. Lead poisoning can cause significant health issues in children that can lead to long-term damage. As stated previously, Winter Haven has a very high violent crime rate that needs to be addressed for the area to be considered a safe community. The City of Winter Haven's water supply is operated by the Utility Services Department. The 2015 Annual Drinking Water Quality Report showed that all monitored contaminants were well within acceptable ranges. The Wastewater Division of the City of Winter Haven continually manages the sewage system, including mains and lifts. Curbside collection of solid waste is provided by the City of Winter Haven. Hazardous waste can be disposed of for free at the Polk County Household Hazardous Waste Day event. Polk County tracks air quality by the Air Quality Index. In 2015, there were 314 days that were rated good. Polk County has implemented a mosquito control unit to evaluate and control the number of mosquitoes in the county. Parks and recreation. Winter Haven offers many recreational activities and parks, including the Rowdy Gaines Olympic Pool, Winter Haven Recreational and Cultural Center, the Rotary Park, and the Chain of Lakes Downtown Trailhead Park. Food stores and restaurants. Several grocery stores exist in Winter Haven. These include 3 Publix, a Winn-Dixie, 2 Walmart stores, a Save-A-Lot and Aldi's, and 3 health food stores. There is also a meat market, a Hispanic market, 2 Haitian markets, and a Vietnamese market. There are also many restaurants that provide sit-down meals or fast food drive-thrus. The Winter Haven Police are dispatched to Polk County Sheriff's Office, and they participate in many community programs. Animal Control of Polk County detains and keeps stray domestic animals at their shelter, and nuisance wildlife, including alligators, are trapped or handled by the Florida Fish and Wildlife Conservation Commission. The Winter Haven Fire Departments and the EMS services they provide averages 6.5 minutes in response time. They are also involved with many community programs. Private emergency ambulance services are also provided through AmeriCare, which has neonatal transport and bariatric units. Tampa General Hospital sponsored Airmed helicopters for emergency flight transport to cover Polk County. Environmental issues in Winter Haven are related to having too many fast food restaurants available, which could lead to increasing population obesity. Also, the road crossings and protective gear are not frequently used, and this does not appear to be addressed by local law enforcement. Government and public policy. County commissioners are elected officials whose term lasts 4 years. They approve the fiscal budget, disclose all policy and legislation to the public, participate in community events, conduct public outreach to identify needs, and reply to requests and questions. The mayor is elected on the city commission, then appointed to the position of mayor by the Polk County Board of City Commissioners for 1 year. On an economic level, Winter Haven is in the process of reducing business rent tax until the tax is eliminated. Politically, the city of Winter Haven is trying to buy Nora Mayo Hall for government offices and large events. Related to policy, almost $7 million for renovations and operation management are needed by Polk State College, and this is in process of being discussed now. Community problems. Obesity is a preventable disease that leads to other diseases. This is a priority community problem because it really is preventable and more could be done to educate the public and support healthier behaviors. So many Winter Haven residents are obese or overweight, and this increases their medical costs as well as potentially reduces their quality and quantity of life. Winter Haven residents frequently jaywalk and do not wear protective gear while bike riding. Traffic safety comes in second as a community problem because the risk of death is so high and the behavior is so easily preventable. Smoking is a community issue for Winter Haven as residents can be seen smoking outside regularly. This is an issue because smoking increases the risk for diseases, especially cancer, and then also leads to increased medical costs. Drug abuse. Methamphetamine has been a problem for Central Florida for a long time. Polk County sheriffs have been diligently working on reducing the problem, but it still exists. Illicit drugs in general increase risk-taking behaviors, risk of infection by bloodborne pathogens such as hepatitis or HIV, and death. Poverty and crime are very important issues for the community. Poverty can create lifelong behavioral changes, reduce access to education and healthcare, and can be cyclic in nature. Crime leads to fear, harm, or even death. These two are prioritized last not because they are less important, but because of the substantial resources needed to address them. Obesity is a worldwide issue that leads to other diseases and increases healthcare costs. In 2014, Mexico implemented a tax on sodas and banned advertising within children's television broadcast production. While it is too soon to know if these actions are reducing obesity, the sale of soda has been reduced substantially. Polk County and Winter Haven are addressing the obesity issue through an initiative called Building a Healthier Polk. There are 6 strategical areas to the initiative, which include targeting school-age children, college students, and general communities' access to physical activities, primary care physicians' clinical practice, worksite wellness programs, and raising public awareness. A community health nurse can address the obesity issue by using evidence-based practice to help develop policies and also by becoming involved in any level of government with regards to obesity issues.